The vaccine rollout is still very much a work in progress. So too is the state's first mass vaccination hub, but it'll open next month.
This vaccination hub will be necessary to get the Pfizer vaccine out to everybody who is in those categories of individuals who need it.
The plan is for 30,000 vaccines to be administered per week. They'll be predominantly Pfizer. AstraZeneca, though, will be given too.
We're also encouraging anybody who has underlying health issues, who's in the relevant age categories, to go through your GP when you're getting the AstraZeneca vaccine.
The government insists its priority remains for now finishing the rollout to health workers. There are about 50,000 to go, and now the state will help the Commonwealth vaccinate aged care workers. But the government is also worried about vaccination rates because of a loss of confidence. It says there's been a 70 to 80% decline in health workers showing up for the AstraZeneca jab. That's over the past 2 weeks since the expert advice changed and recommended Pfizer as the preferred choice for under 50s because of blood clot fears. About half of all health workers are under 50, but we don't know the age of people refusing AstraZeneca. At one Sydney hub, 128 vaccines were done on one day. The advice changed, and 2 weeks later, no one turned up.
Health staff have voted with their feet at the present time and seen a 70 to 80% reduction. I'm hoping that will turn around over the next few weeks as more information becomes available.
There was no new information about how COVID was potentially transmitted among returned travellers at a quarantine hotel in the CBD. They stayed in adjacent rooms and have been infected with the same South African strain.
Some places, and I don't know if this is true of these hotels, some places have more old-fashioned ventilation systems, particularly in places not designed to be healthcare settings.
We need to understand very quickly what has happened and what is going to be put in place to ensure it doesn't happen again.
In Perth, there's also an investigation as to how 2 people in a quarantine hotel contracted the UK strain from other returned travellers staying in another room. Ashley Raper, ABC News.